Hi, my name is Dr. Dirk van der Spey and I'm an orthopedic hand surgeon practicing in the southern suburbs of Cape Town. Welcome to Cape Hand Surgery. The Quervain's Tenosynovitis is a very common and regarded as one of the most painful wrist conditions affecting the radial side or the thumb side of the wrist. The condition is poorly understood, but basically what happens is the tunnel of the tendons that move the thumb is thickened up, creating less space for the tendons moving through it. The friction between the tunnel and the tendons causing inflammation, and this causes severe pain, and any movements, essentially moving the thumb, lifting the thumb or bending the thumb, creates a lot of discomfort. The position of the pain is usually on the radial side of the thumb where the tendons run through. The anatomy will be described in this video, and essentially it shows the tendons that run through this compartment, and this correlates very well to the position of the pain.
Tendons come through here. This other one could come at a bit more of an angle, and then they go through the tunnel and they come out here again. The top one is called extensor pollicis brevis, and the bottom one is abductor pollicis longus. And now this one you'll have multiple slips. But when this is thickening, it creates inflammation on the tendon sheath. And so literally whenever time you move this, these tendons are getting stuck in the tunnel, and that's what's causing the inflammation. So if we get a cortisone injection around here, hopefully this will settle this area.
Yeah, and I won't have any of this when I suddenly do that.
Let's hope.
The treatment for the Quervain's Tenosynovitis is usually conservative treatment first. Cortisone injections is usually 80% effective for most people, and we tend to try 2 to 3 cortisone injections before we consider any surgical intervention. The injection essentially aims to get cortisone in and around the first dorsal extensor compartment, and this is thought that it might reduce the swelling and enables the tendons to glide better. The injection usually is aimed to go under the skin and just get the cortisone diffuse in and around the first dorsal extensor compartment.
Okay. So just going just distal to the first dorsal extensor compartment. Just get it under the skin there. You okay?
I'm fine. Definitely not as bad.
The injections typically takes 4 to 7 days before it really kicks in, and it can last for up to 4 to 6 weeks. We typically can repeat 2 to 3 injections, and at that stage, if things don't get better, it's probably best to have a surgical release. And the surgical aim is to go and release the first dorsal extensor compartment and take away all the inflammatory tissue around the tendons that goes through this tunnel. If you're battling with pain on the radial side of your wrist and find it very painful to move your wrist in ulnar deviation, I think it's best to have it checked out and see how we can help you. Thanks for watching, and please feel free to visit the website at www.capehandsurgery.co.za or follow us on Instagram or Facebook.